Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is May 13, 2025. This is a video on a Nature Medicine article which was published on May 7, 2025. It's open access. Anyone can access this article. Titled Cardiac and Liver Impairment on multi-organ MRI and the risk of major cardiovascular and liver events. Cardiovascular disease and metabolic dysfunction associated steatotic liver disease, MASLD, are linked with high mortality and morbidity. This study evaluates how cardiac, as evidenced by reduced left ventricular ejection fraction equal to or less than 50%, and liver impairment, as evidenced by iron-corrected T1 or CT1 equal to or greater than 800 milliseconds on MRI, relate to cardiovascular or liver events among 28,841 UK biobank participants. The age data: median age 64 years, standard deviation 8, age range 40 to 69 years, 53% by women, 17% had a BMI equal to or greater than 30. Methodology: prospective cohort study using UK Biobank data 2016 to 2020. Cardiovascular MRI was used to estimate left ventricular ejection fraction, and anything less than or equal to 50% was a marker of impairment. Liver MRI was used for evaluating iron-corrected T1 or CT1 equal to or greater than 800 milliseconds as a marker of inflammation. Statistical analysis included Cox proportional hazard models adjusted for type 2 diabetes and dyslipidemia. Key findings: cardiac impairment, that is a left ventricular ejection fraction equal to or less than 50%, was linked to a higher risk of cardiovascular events, hazard ratio 2.3, and hospitalization hazard ratio 2.1. Liver impairment, as evidenced by iron-corrected T1 equal to or greater than 800 milliseconds, was linked to increased cardiovascular hospitalizations, hazard ratio 1.3, and liver events, hazard ratio 9.2. Combined cardiac and liver impairment accelerates cardiovascular event onset, 0.8 years versus 2.4 years. Key takeaway: multi-organ MRI can aid in integrated risk assessment for cardiovascular and liver events. Combining cardiac and liver metrics improves prevention strategies. The strengths of the study is a large sample size from the UK Biobank, comprehensive multi-organ MRI data, prospective cohort design enhancing temporal assessment, rigorous statistical analysis, and an integrated approach for cardiac and liver risk assessment, and diverse cardiovascular outcomes. Limitations: ethnic homogeneity, 91% for white British, limiting generalizability, short follow-up period, median 4.3 years, patient selection bias from imaging subset, potentially, low number of liver-related events, limiting statistical power, lack of comprehensive liver disease metrics, example, hepatic encephalopathy, MRI limitations in correlating with histology, underreporting of COVID-19 impacts, and a UK-centric data limiting international applicability. Podcast brought to you by Master MedFacts at mastermedfacts.com.